Well, it's time to take two and call us in the morning. Your favorite twin doctors, Dr. I and Dr. J, are back with answers to your burning health questions this morning. Dr. J, I think it might just be you and me now. I think Dr. I lost signal. Do I have this correct?
That could be correct. I know he's
Jay, there you are.
Hey, he's in Sri Lanka. He's traveling, living his best life. So I think there's kind of a sketchy Wi-Fi there. So we'll take it.
We'll give him a pass for today. In that case, let's play our favorite weekly game, just the two of us. Let's start with this. If you, your partner, or one of your older children has a known peanut allergy, true or false, it is best to avoid introducing new children to said peanuts before the age of 3. I'm going to say false on that one.
100% it's false.
Yeah.
So, we're seeing more and more allergies to foods, peanuts, milk, dairy products, pollen, dust, you name it. And part of the reason is because of something called the hygiene hypothesis. So the thought used to be that the longer you waited to expose somebody to something, the less likely they were to get allergies. Opposite is true. It's better to expose earlier, because when you expose earlier, the immune system recognizes that, hey, this is something that I'm going to be exposed to frequently. It's okay. I don't need to overreact to it. So now research is saying, in particular with peanuts, but also with other things likely, if you expose within the first 3 months, you're going to reduce the risk of allergy by about 77%. Expose within the first year, about 33%. So the earlier the exposure, the better. Now, you want to do it kind of in a measured fashion, just to make sure that the immune system won't overreact. And it's always a good idea to have things like EpiPens around just in case there's a reaction. But now it looks like the earlier the exposure, the better.
That was one of my first questions I had for my pediatrician, because I have a shellfish allergy. So I was wondering if that could be passed down to my daughter. And he said, no, go for it. Start giving it to her. True or false, if you want to prevent lower back pain, the best sleeping position is on your stomach. False.
False. Okay, you're 2 for 2. Looking good.
Hey.
That's right. So, hey, there you go. So it's actually the opposite. When you lie on your stomach, you increase the risk of low back pain. And low back pain happens to a lot of folks. 80% of Americans at some point will have lower back pain. And basically, when you sleep on your stomach, you just distort your anatomy. And so you tend to compress the discs. And so the discs are more likely to herniate and press on nerves and cause pain. Also, you tend to contract your muscles. So when you're sleeping on your back, typically your neck's a little bit up, you contract the muscles between the discs and the back. And then when you get up in the morning, because those muscles are contracted, when you start to move and stretch, especially if you work out in the morning, you're likely to stretch those muscles too quickly and potentially tear them and cause strains and sprains. And so the recommendation is sleep on your back rather than your stomach. And to try and prevent yourself from kind of turning, somebody who tosses all over the place, they recommend getting a weighted blanket, which I actually have. The weighted blanket tends to keep you in one position, and it helps with anxiety as well. And they recommend kind of putting pillows on the sides of your mattress. That way, if you want to turn, the pillow kind of blocks you. And so pillows on the side, weighted blanket, stay on your back. Less low back pain.
Okay, I'm going to pass this on to my husband. He and I have both been out of commission the past couple of weeks with back issues.
Really?
So we have a weighted blanket, and lying on our backs it is. Okay, true or false, drinking champagne can reduce your risk of heart disease and heart attack? False. I'm going to say false to that one, too.
That one is actually true. That one is actually true.
A big win for a lot of people and weekend brunchers.
There you go. Time for that early morning mimosa. But so for the longest time, we've talked about the benefits of red wine, right? We say, red wine, because of the resveratrol, the antioxidants, can reduce the risk of heart disease, heart attack, stroke. Well, white wine and champagne could do the same thing, because basically they're also derived from grapes. However, you get rid of the seeds, you get rid of the skin, and that's where most of the antioxidants are contained. So champagne still has those antioxidants, not to the same extent as red wine, but still has them. And so the research has shown that you potentially could reduce your risk for heart disease, heart attack, and stroke by anywhere from like 30 to 70% if you're doing white wine, champagne, and certainly if you do the red wine. But champagne looks like champagne for the win as well.
Hey, the fountain of youth. Bring it on.
There you go.
We'll pop a bottle for you in honor of you this weekend. Thank you so much, Dr. J, for staying. Tell Dr. I we said hi. Sorry we missed him this time around.
Yeah, you didn't miss anything.
Yeah, maybe you won't relay that message. Hey, see y'all next week. To have your medical or health questions answered on our show, find Dr. I and Dr. J on social media at @the_twin_doctors or visit their website for more.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.